What's up everybody, Luke here from Luke's LooksMax Lab. Today we're going to be discussing MSE and we're going to be going over the risks and possible rewards of MSE. We're going to be discussing why you might want to get MSE and why you might not want MSE. If MSE should be done before or after jaw surgery. If you would like to contact my email or check out my website, be sure to check the links in the description. And if you have any comments to leave about this video, go ahead and leave a comment down in the comment section and I'll reply to any comments that actually are not garbage. Let's start with this whole MSE explanation. So I've had two MSEs. The first MSE I had 36 turns. The second MSE I had 71 turns. Both of them helped expand my maxilla. In total, I had probably about 8 millimeters of expansion. I had more expansion on one side, which brings me to my first risk of MSE, which is asymmetry. So if you're doing a large expansion like I did, the risk for asymmetry is going to be greater. One side is always going to be stronger than the other side, so it's very likely that one side expands more than the other. So the asymmetrical expansion can work in your favor or work against you, but most of the time it works against you because it's not calculated and there's no guides or brackets helping this expansion. It's literally just the MSE and there's nothing else. The only thing else that's holding back the MSE is your body, so that causes this expansion to be asymmetrical a lot of the times. Another thing that can happen, if you're thinking about how the mechanics of MSE work, when you tip two sides of the maxilla, if you do get a split, the middle of the maxilla comes down, so that causes the smile to get more gummy a lot of the times. This can be also a benefit or a detriment to your LooksMaxing journey, because you might have a shorter maxilla and you might need that. You might need that bottom part of that maxilla to come down a bit. And if you don't understand what I mean, if you're taking two cubes that are butted up against each other, let's say this is the right side of the maxilla, this cube, and this cube is the left side of the maxilla. If you tip both of those cubes, the inner corners of each cube are going to end up at a lower position than when they first were initially butted up together. And we're just talking about if they're staying on the same place in the same horizontal plane, if they're not going up or down at all. But another thing that the MSE can cause is it can cause the maxilla to get pushed forward and backward as well. Because both sides of the maxilla are free, when this device starts to rotate, it can actually push one side of the maxilla forward more than the other side, which also did happen to me as well. So I have a little bit of forward growth on one side compared to the other, because that device actually ended up pushing and expanding asymmetrically and pushing one side off that way. So this isn't going to mess me up at all because I have everything set in place, and it wasn't a risk for me to do MSE because I had a surgical plan set up already. If you don't have a surgical plan set up, MSE, in my opinion, is going to be a way greater risk because you're not covering yourself for things that can happen during the procedure. So far I've kind of just explained the mechanics of how MSE works. If we come back to kind of what I started making these videos about, which was like face pulling stuff, I kind of made this channel to just make those videos because I saw that thread and I was like, this is interesting, I can do this myself. That's how I started this channel, bro. And it was orthodontic appliances still. They were still technically orthodontic appliances, but I kind of learned how to use that orthodontic stuff. And it also helped me learn about orthodontics when I started learning about face pullers and stuff. This was back in 2019. With the MSE, right, part of my face has moved forward. There's so many people in this community that do not want surgery. They don't want to get surgery. But they're willing to spend hours and hours on end every single day and waste like a year of their life doing something, dedicating something, as in like bone smashing, mewing, even face pulling now. But that's the reason I'm introducing this, is because if you do an MSE and then come up with a face pulling device, I have an idea of how it's going to be made, but I'm not going to release that shit. If you're interested and want to contact me about this, I can explain how the device would be created, and it would technically work. In theory, if you were to do this face pulling stuff for 10 to, you know, extensive amounts of time per day, technically this would work because you're pulling forward the maxilla and the screws are bone borne. And also when you split the suture like that, you're loosening the back suture, every single suture is loose on the maxilla. So another way you know that the suture is loose is just because you can feel it. You know, when you start doing MSE, you can feel, when you're eating, you can feel certain things like that you weren't able to feel before because it's not solid. It's been split open and it's loose now. It needs to be used properly is what I'm saying. It can't be just used willy-nilly. You can't throw it on everyone, say, you know, one size fits all. This is going to make everybody look better. So that's not how that's not what this device is. You know, everything with this needs to be properly set up, planned out, then it will come out properly. So mine actually did improve my appearance a good amount because it stretched out the skin on my mid-face and gave more support. MSE removal and continuing on after you have done an MSE treatment. The day that you get MSE removed, it's going to take a couple of weeks for the bone and everything to set properly. It is recommended to wait 2 weeks before getting aligners or orthodontic stuff done, such as braces as well. You know, if you plan out your whole looks maxing plan properly, most people can do their entire thing under a year, but the problem is that when you're balancing life, social stuff, and all this, it's kind of hard to plan out something that gets completed as quick as possible, which that's just how it goes. That's how it goes when you're involved in this kind of stuff and you have goals, you know. You're gonna have to go around obstacles and things. And everybody's on their own schedule as well. Lastly, touching on the topic of MSE, MSE does increase your IPD. It doesn't make sense that it wouldn't increase your IPD because just mechanically that's how it's going. If you're doing 8 millimeters down here, you're gonna get at least 1 up here. We hit 825 subscribers currently, so thank you for that. I appreciate everybody for subscribing to the channel and watching and also commenting. Thank you. So let's go ahead and read comments. I need to expand my upper maxilla. What do I need for this apart from LaForte 3? So LaForte 3 isn't what you would need for that. And also, I did reply to this guy and I said I would need to see what you look like as well. It's not really possible to expand your upper maxilla without any crazy osteotomies. But if interested, let me know and I can go more in depth about that. This is why Kosiani is better than Alfaro. First use cutting guides and the second is freehand. What software would you use for planning? So there is a lot of different softwares, and it's not just one software that's used for doing 3D surgical planning. It is a 3D software that allows you to basically segment the STL files the same way that you would do the surgery, and then the guides and stuff are designed around the movements, and then the guides and plates are manufactured. So this guy says, I'm struggling to see the purpose of my consultation for cutting guides. At the end of the day, you're not the surgeon. They have the final say in the movements. Shouldn't the focus be on finding the best jaw surgeon? You just need to make sure you don't go to a shitty surgeon. All the patient needs to do is express their aesthetic goals. Yes, exactly. So that is exactly what I do. I'm not creating 3D plans for you. What I'm doing is pointing you in the right direction socially, with your looks, your aesthetic perception as well. Right now, I guarantee you there are a lot of things that you can do that are non-surgical. One, you know, having a better state of mind when you're approaching a lot of this stuff, because it's really easy to get overwhelmed and overthink things when you're trying to plan out your surgical plan. A lot of people just get really stressed out when they're trying to plan out their surgery plan, and they plan a lot of things that they don't even need because they think they're uglier than they are. I'm one of the best set of eyes on the internet in terms of giving you the correct plan that you need. Anyone that comes to me about their case and wants to discuss their case is going to be on the right track after coming to me. Some really cool stuff coming soon also about Instagram, Tinder, social media. I'm going to start making content about that. Most people should be able to know which side will expand more because it's not just about strength but also about pre-existing asymmetry that becomes amplified along the expansion plane. I have condylar hyperplasia, so we'll only do MSE after corrective surgery. To deal with this, you'd have to do the maths and geometry to change the location of the guide holes with a drill so that the more resistant side gets force. I thought that I replied to this comment, but I didn't reply to it. There's not going to be a way to determine the asymmetry or which side is going to expand more. Drilling in a certain spot of the maxilla isn't going to make a huge difference at the end of the day, because there's literally just no way to know based off the body. And okay, that was a good point though with the pre-existing asymmetries. I think that would be the only way that you're able to tell, but I don't think that drilling the MSE into a different spot is going to make a huge difference for this MSE device, which isn't usually done. Usually the MSE is done where it's just installed, but maybe we will start to be doing custom planned MSE devices that expand the maxilla a lot more exactly than currently. I know that people are into fabricating their own rapid maxillary expansion devices. So that's going to be something interesting that we'll see in the future. I'll definitely create another video on that if that's something that starts to become more popularized. I'm wondering how much your initial structure affects the outcome of expansion. Did you have much downward facial growth to begin with? Pre-expansion, I had above average forward development of my maxilla. Getting my expansion basically just revealed how my face naturally should have been. But if you're expanding a face with downward development, surely it could result in some unnatural looking faces. I think Mike Mew doesn't work on adults with hectic downward development for that reason. If that's true about Mike Mew, then that kind of just shows how he runs his practice. So downward facial growth, I wouldn't say I did, and I would kind of agree with that, because if your face is extremely downward grown, you might not want to do MSE. But the thing is, and I'm specifically talking about the maxilla, but the thing is that if you're narrow, you're going to need to expand either way. So if you're narrow, you're going to need to expand, and then you're going to need to correct the downward growth with surgery. Can you do a tutorial on how to self-apply MSE and how to remove it? No. How is your intermolar width changed? That's probably changed about 8 millimeters. Can you do MSE after double jaw surgery? I replied no, because it's just easier to do it that way. But then this guy says, why not, bro? Giant Implant said you can. Is it because it is harder to have lateral width gain after you've already pushed the maxilla forward via surgery? I say that because you're going to need to wait months after, if you end up installing the MSE, just to have the MSE expand, the bone to heal. Also, the bone needs to be fully healed, and the brackets need to be removed. This guy said comb my hair, and that video was the video I made 2 videos ago. My hair looks good in that video, bro. I don't know what you're talking about. But anyway, links are in the description if you would like to book a one-on-one video call with me and you want to have your pre-treatment plan set up 100% accurately, how it should be. Go ahead and book a consult in the description if you're interested. If you have any questions and would like to send me an email, my email is in the description. And if you have any comments about the video or want to ask me any questions, go ahead and leave a comment. I appreciate everybody watching the videos and subscribing. I'm going to keep making more videos. We're coming out with 3 more videos this month, so stay tuned. Actually, no, 4 more videos this month. Stay tuned. I'll see you in the next one. Thanks for watching.